I was at the mental health center as clinical director when Dick came to be medical director, which was a wonderful day.
I came in 1976, and Phoebe was on the hiring committee.
And so we were a team then, from then on.
People were embarrassed to say that they were in marriage counseling or, heaven forbid, in therapy. People would think they were, quote, crazy, when they were just normally neurotic like the rest of us.
We stood side by side with those values, and it was to every degree possible to keep people in open settings in the community and with their families and out of nursing homes and the hospitals to whatever degree possible.
It was an exciting time to be in the field because anything we could think of, we could develop. We began to reach out to other communities to see what we could do to help them in terms of their needs. And I think we began to do some really interesting and good work.
So it was a fun time to work. There were lots of new programs developed in those 14 years that I worked here.
Over time, Mental Health Partners has really embraced evidence-based practices and bring mental health services out into the community, and also develop services that are innovative, creative, and very much integrated with the rest of the system.
The concept of community mental health centers as it started out had a lot to do with our being out in the community.
We are dedicated to being a provider in our community that helps people who have no other place to turn.
About 1 in 4 people is affected in some way by mental illness.
Over 30% of the people in our jail have some sort of diagnosed mental illness.
I think every county jail has an issue with people who are in the jail who probably are less criminals and more need mental health assistance, and our jail is no different.
The courts, in partnership with the Sheriff's Office and the Probation Department, started a program called PACE. It's the Partnership for Active Community Engagement. They got a federal grant that enabled them to rent some space and put a probation officer, a mental health professional, a caseworker, all the people that needed to be involved in this man or lady's life under one roof.
Inside of 5 months, we had developed a project called PACE, and it's been operating ever since, and it's reduced jail numbers among that population by 95% consistently over a period of 13 years.
The clients who came to the PACE program would have cost the city hundreds of thousands of dollars more by having to be in jail than by coming to our program.
Unless there's intervention and treatment, and unless they're stabilized, and unless they're referred to community-based mental health treatment, it's just a vicious cycle.
Mental health obviously has a pretty huge impact on years of life lost, and it's so important to be able to have quality of life, and without good mental health you can't have good quality of life, you can't have good public health.
My son died a year and a half ago. He was mentally ill. He was bipolar and also alcoholic, and died of his alcoholism at age 43. And generally we know that mentally ill people will have a shorter lifespan by about 25 years than the average person, and in Paul's case it was closer to 40 years, the shorter lifespan. It wasn't as though he was a vagrant or anything. He was a trained architect and had gone back to school and gotten an engineering degree at New York University. And he was a very ambitious fellow, but he just couldn't control, what the mental illness.
Starting my treatment some 30 years ago, really identified with mental illness. There wasn't a day that went by when I wasn't like Kate, the mentally ill person. And now I wake up in the morning and I take my pills and I do my day, and I hardly ever think about it, except for when I have the great good fortune to share my story with clients.
We have a wide range of services. Certainly there are times when medications are amazingly effective for people, but there are also times when that's not the only thing, and it's just one small part of the whole treatment package.
The key to the services in Boulder County are about collaboration. And Mental Health Partners is truly a collaborative partner for our agency. So for instance, Mental Health Partners serves the kiddos and families who are in our Head Start programs, working with trauma, behavior concerns, depression, anything to support the whole family around a comprehensive early childhood system, which includes mental health services.
Mental illness frequently strikes in adolescence or young adulthood when people are building their lives, when people are working towards goals and dreams, and planning what their life will be.
It's pretty awe-inspiring, if you will. I mean, we've got an amazing child psychiatrist who's here every week. We've got amazing therapists, clinical direction, leadership, cutting-edge kind of clinical approaches. We have the most amazing behavior specialists that are working with our kids and alongside our teachers, our special ed teachers in the classrooms every day, with some, kids with some pretty unique challenges. We want to see our kids be successful at school. We want to see them be successful at home. We want to see them be successful in their communities, and we're able to do that because of this partnership.
I just would not have been able to make it through the public school system without day treatment and the assistance and support that I've received through the program.
Now I have a mental illness. There's nothing I can change about it. All I can do is work to improve it. It's nothing to be ashamed or embarrassed of. It's just a new challenge to face.
Our job collectively is to try to find a way to stabilize families, to ensure that they don't fall further into crisis. Our systems are really designed to focus on that early intervention, prevention activity in partnership.
It's just so much more soothing to know that I can have someone that I can talk to once a week that can help me talk about things that I need to get out and not have to ever have someone that's there. It probably would, I think for me, build up and possibly cause me to lose my sanity again if I didn't have someone to talk to every week.
Our clients carry around this notion that they are somehow unable to function because they've accepted this label of mental illness. And so that internalized stigma is one of the things that makes their success in our work so much more difficult.
Many people don't want to have a mental illness and want to think it's anything but a mental illness. So our first task is to help them come to terms with it's not your fault, it is an illness, it can be treated, and it doesn't have to be the organizing principle of your life.
You access who you are in your heart. You're not sick, really. You're just treading your path,
Be open-minded to people with mental illnesses. We're normal, we can succeed, we're not contagious.
Most people, when they are experiencing a mental health problem, go to their primary care provider. They're unable to sleep, they have pains, whatever it might be, they're feeling anxiety. They'll actually go to their doctor with that problem. And so by bringing mental health services into the community health center, when people come in thinking they need to see a physician, but they really need to see a behaviorist, we've got the behaviorist right there on the team, and they can see that person immediately. Somewhere along the line, we separated out the body from the mind, and thought of mental health and physical health as two separate things, and they really aren't. A lot of people's physical health has to do with their behavior, and really it's the people in the mental health field who are the best at helping people think about changing their behaviors. So we really realized that integrating the services of the Mental Health Center and of Clinica was going to be important if we were going to improve people's health in the community.
We will continue to work to provide excellence. I just want to say thank you and express my appreciation for the people who have been so dedicated to Mental Health Partners over those 50 years and who have really established a solid foundation that we continue to build on.
Mental Health Partners is a tremendously positive force in our community.
Thank you for being willing to sit around all of those tables at the innumerable meetings that I call and share your innovation, creativity, and vision with all of us.
People need to be heard, and people need and listened to and appreciated for who they are and helped they need to be helped in terms of giving them opportunities.
It's been a big thing for us. It's been a
so
very
much more than
positive
that.
thing in our lives.
There's just an infinite reasons. I
Yeah.
mean, there's so many, you can't just tell them all. There's so much there.
I cannot express enough my gratitude for all of the ways in which the mental health system has helped me to get my life back in so many ways that I would never have dreamed.
It's been an exciting experience. I will always cherish it and remember it with a full heart.
I love this place. I love working here. I love the clients. I love my coworkers. I love the fact that we are reaching out to the community.
Mental Health Partners, long may you live.